critical lung cancer symptoms you should never ignore. Did you know that lung cancer is the leading cause of cancer-related deaths worldwide? In the United States, it ranks as the second most common cancer in both men and women, accounting for about 1 in every 5 cancer deaths, surpassing the rates of colon, breast, and prostate cancer combined. Estimates for 2023 project about 238,340 new cases and 127,070 deaths. Today, let's explore this concerning trend and provoke a meaningful debate. Make sure to watch until the end, because there's a list of the most common lung cancer symptoms that you might be experiencing. But first, it's crucial to understand the impact of lung cancer. Breathing is so fundamental to life that we are born already knowing how to perform this action. The lungs are a pair of organs located in the chest cavity with a vital role in oxygenating the blood, enriching it with oxygen, and distributing it throughout our body. How does lung cancer occur? It starts with a normal cell that undergoes a genetic change. This altered cell begins to grow, multiply, and occupy space that should be filled by healthy cells. Lung cancer can not only impair lung function but also break natural barriers and enter the bloodstream, leading to metastases in other parts of the body. There are 2 main types: non-small cell carcinomas, NSCLC, and small cell carcinoma, SCLC. NSCLC is more common and tends to grow more slowly, while SCLC is less common but typically grows rapidly. Smoking accounts for about 85% of cases. However, other risk factors are on this list, and we'll discuss them shortly. Most of the time, tumors in the lungs are discovered late in their advanced stages, which reduces the chances of a cure. Therefore, it's important to be aware of certain symptoms and not delay diagnosis. Prevention is always better than cure. Now, let's delve into the 10 lung cancer symptoms you should never ignore. 1. Persistent cough. Coughing can be very bothersome, especially when it's time to rest or sleep. While often associated with colds, flu, and other conditions causing throat irritation, coughing is the lung's primary defense mechanism. This symptom could indicate anything from a simple cold to something more serious, like pneumonia. Coughing prevents foreign substances from entering the lungs and helps eliminate secretions. Occasionally, it's normal to cough. What's concerning is a prolonged cough. If you find yourself coughing repeatedly for weeks or months, it's essential to understand that this isn't just a passing nuisance. Initially, the cough might start as a dry and persistent irritation, but over time, it can progress to something more serious, sometimes involving coughing up blood, which is particularly alarming. 2. Chest pain. Chest pain is a sensation that should not be underestimated, especially if it worsens when coughing or taking a deep breath. If you experience chest pains, or thoracic pains, the best course of action is to seek emergency medical care quickly. In most cases, these pains are associated with less severe causes, such as anxiety, muscular issues, or digestive problems. But it's not worth taking the risk. It's essential to investigate any persistent discomfort in this area. 3. Coughing up blood. Clinically referred to as hemoptysis, coughing up blood can appear in 2 ways: as single episodes or continuously. What's most important is to pay attention to the details accompanying this condition. It can occur in young, healthy individuals without bad habits, due to an injury in the airways, mouth, nose, throat, etc., or even because of dryness caused by frequent coughing. In this case, it's considered a single episode or short-lived. However, in persistent cases, where one might have tried some treatment and the cough still comes with bright red blood, it could indeed be seen as concerning. It might be the body's way of indicating that something more severe is occurring, such as pneumonia, tuberculosis, or even lung cancer. If this happens, seek medical assistance immediately to evaluate the cause of this serious condition. 4. Night sweats. Also known as nocturnal hyperhidrosis, night sweats refer to excessive sweating during sleep. It's usually caused by some underlying factor. Frequent and unexplained night sweats could be indicative of lung issues, among other medical conditions. Despite its many causes and not always being of concern, if paired with other symptoms like fever and weight loss, it could suggest something more serious. Number 5. Hoarseness. Hoarseness typically occurs due to the misuse of the voice, such as excessive shouting or speaking for more than 10 hours straight, or because of an injury to the larynx, like the flu or laryngitis, a type of inflammation that affects the larynx. If your voice remains hoarse over an extended period, it might be more than just a weary voice from overuse. Persistent hoarseness could be a warning sign of an underlying condition that requires medical attention. 6. Shortness of breath. The sensation of shortness of breath, even during light everyday activities, is a significant concern. This can indicate that something is obstructing your airways, making breathing more challenging. When there's an obstruction in the airways, the intake of oxygen into the lungs is hindered. This can be caused by blockages in the throat, nose, or trachea, resulting in a feeling of suffocation. This obstruction can be triggered by various conditions, such as severe allergies, inflammation of the airways, pulmonary edema, or even the presence of foreign bodies in the respiratory tract. This symptom can arise for various reasons, some of which aren't always directly related to breathing. When it comes to difficulty breathing, it's crucial to understand the possible causes to seek appropriate solutions. 7. Loss of appetite. If you notice a significant loss of appetite without an apparent reason, this warrants attention. Loss of appetite can be a symptom associated with various medical conditions, including lung cancer. Before we further explore the following symptoms of lung cancer, don't forget to subscribe to our channel and activate notifications to stay updated with our informative videos. 8. Unexplained weight loss. Stepping on the scale and noticing that a few pounds have been shed without effort is a dream for many. However, this symptom should be a cause for concern when it occurs unintentionally, without one realizing they are losing weight. In general, it's considered normal to lose weight after going through a stressful situation, such as changing jobs, ending a relationship, or losing a family member. However, if the weight loss isn't linked to these factors, and neither to dieting or increased physical activity, it could indicate the presence of a health issue, such as thyroid disease, uncontrolled diabetes, or even cancer. Therefore, it's important to consult with a general practitioner for an evaluation and to undergo diagnostic tests in order to identify the cause of the unintentional weight loss and begin the most suitable treatment if necessary. 9. Chronic fatigue. Chronic fatigue, characterized by chronic fatigue syndrome, CFS, is a medical condition where the primary symptom is the presence of intense tiredness that doesn't improve with rest. This means that the person feels persistently tired, regardless of the amount of rest they get, and it can worsen with physical or mental activity. Though the cause of CFS remains unknown in many cases, factors like infections or psychological stress can trigger the onset of symptoms. If you are constantly exhausted, even after an adequate period of rest, it's important to seek medical guidance to investigate the cause and receive the appropriate treatment. Persistent fatigue should not be underestimated, as it can be a sign of underlying health issues, including lung cancer. 10. Recurrent lung infections. If you're experiencing frequent lung infections, such as bronchitis or pneumonia, and they don't seem to fully improve with treatment, this might be a warning sign of lung problems. However, these symptoms are also common in individuals with chronic bronchitis or pulmonary emphysema due to smoking. In such cases, if symptoms persist for several weeks, they could be indicative of lung cancer. Therefore, patients need a medical evaluation to rule out this possibility. In addition to the symptoms, it's essential to understand that lung cancer is a global challenge. Yes, it can be prevented, and we're about to show you how. Risk factors for lung cancer. The more a person smokes, the greater the daily number of cigarettes and the number of years they have been exposed to smoking, the higher the risk of developing lung cancer. Passive smokers, individuals who don't smoke but are near smokers, also face a significant risk, albeit smaller than that of active smokers. Other risk factors include pollution, radiation exposure, like that experienced by uranium mine workers, and asbestos fibers used as thermal insulators in some countries. If people who work with these materials also smoke, they face an even higher risk. Less frequently, the disease can occur in people who haven't been exposed to smoking in any way. In the US, the incidence rates of this type of cancer among people who have never smoked vary considerably, highlighting an upward trend. Women seem to have a higher likelihood than men of developing lung cancer associated with non-smoking. Among women, each year, about 14 to 21 new cases of lung cancer are expected to occur in a group of 100,000 non-smokers. Among men, it is expected that about 5 to 14 new cases will occur. A study conducted in Washington, D.C., presented at the European Lung Cancer Congress, revealed that over 23 years of follow-up, 0.5% of people who never smoked developed lung cancer. So this disease is not restricted only to smokers, and other factors play a significant role. Moreover, air quality is a significant concern. About 99% of the world's population lives in cities with air quality below the World Health Organization recommendations. Atmospheric pollution contributes significantly to mortality, causing up to 15% of lung cancer deaths each year. Studies have shown a clear correlation between exposure to air pollution and an increased risk of lung cancer. In 2013, air pollution was classified as a carcinogen by the International Agency for Research on Cancer. How to prevent lung cancer? Preventing lung cancer involves adopting proactive measures to reduce the risk. Here are some effective strategies. The best way to reduce the risk of lung cancer is to quit smoking. Cessation of smoking is one of the most impactful health decisions someone can make, and it's important to highlight that quitting smoking at any stage of life significantly reduces this risk. Promote smoke-free environments, both at home and at work. This not only protects you, but also those who share the space with you. Some research suggests that a diet abundant in fruits and vegetables might provide a level of protection against lung cancer, even for both smokers and non-smokers. Radon, a colorless, odorless radioactive gas, is a significant contributor to lung cancer risk. You can lower your exposure to radon by having your home tested and taking appropriate measures if necessary. How to detect lung cancer? Detecting lung cancer in its early stages is crucial for successful treatment. The most effective examination to detect lung nodules is the chest tomography. Although these nodules are common and often benign, the doctor will consider various factors when determining whether a nodule is cancerous, including its shape, history, and other factors. Another important tool for early detection is low-dose computed tomography, LDCT. This is an imaging scan that can identify small lung tumors even before they cause noticeable symptoms. It is especially recommended for people at high risk of lung cancer, such as smokers or former smokers with a significant history. Identifying lung cancer can be challenging since, most of the time, it doesn't show symptoms. Therefore, it's important not to ignore any symptoms that may appear and to seek medical assistance immediately if you have any suspicions of lung issues. Lung cancer treatment has evolved significantly in recent years with individualized approaches. Options like surgery, radiotherapy, immunotherapy, and targeted therapy are available, and the choice depends on each patient's case. Although talking about illnesses, especially cancer, can be tough, it's crucial to start this conversation, as early detection and appropriate treatment can make all the difference. Lung cancer is treatable, and seeking help early on can result in better outcomes and even a cure. Were you able to kick your smoking habit? Share your story in the comments below. If you wish to stay informed about health and well-being, subscribe to our channel and hit the notification bell so you don't miss out on our next video. Give this video a thumbs up and share it with your loved ones. Also, I invite you to check out 2 more recommended videos popping on your screen right now. Our mission is to continue sharing valuable information to help you lead a healthier and more aware life. Thank you for watching. Bye.